Okay, all right. Well, good afternoon, everyone. Welcome to our introductory talk about RRS products, the current trends for 2025, and also the skin tech peels. And hopefully that will provide some interest and a background into how we wish to move forward with our curriculum, with our training program, which Galina will take over at the end of my talk. So here we are. This is just a quick disclaimer about myself, what I do for work, and any potential conflicts of interest. And we'll just move on to the cosmeceutical trends in 2025. The first one, a lot of you may have heard of by now, are polynucleotides. And just as a basic background, these are long chain molecules made from nucleotides. And in aesthetics, they're commonly derived from salmon DNA. So a lot of you may have heard about these products and have had clients asking about salmon DNA and how it's all extracted. And basically, these are all extracted and put into a special vial, and then we inject them just under the skin. And the main effects are healing, regeneration, rejuvenation, improved skin texture, as well as elasticity, improvement, and an anti-inflammatory effect. So where you have patients, for example, who have sort of acne, rosacea, you can get quite significant improvement in these patients using the salmon DNA or the polynucleotides. Here now, moving on, are exosomes. So some of you may also have heard about these. And basically, these are natural extracellular vesicles, and they are naturally produced by our cells, and they carry sort of vital proteins, lipids, genetic material that allow the cells to basically be in contact with each other. And in aesthetics, when we derive these exosomes from stem cells, there are quite significant regenerative properties. So there is also repair, rejuvenation, new collagen being produced, as well as an anti-inflammatory effect. Now, exosomes have been combined in microneedling techniques, laser techniques as well, and also when we're carrying out basically any treatment which is causing some compromise of the skin barrier, these exosomes can penetrate the barrier and actually carry out the results as we've spoken about. Another new one is subablative laser. This is a new form of laser. If we think of one of the most aggressive lasers being the CO2 laser, which is the ablative laser, this is one below, and it's a thulium laser, which is directed to water molecules. So most people think of laser in terms of targeting pigmentation, targeting hair removal. This is a specific laser now that is targeting water molecules, specific wavelength of 1927. And what it is doing is by targeting the water molecules, they suddenly evaporate with the laser. The laser then makes these microchannels in the skin, and we can use specific products like vitamin A, vitamin C, tranexamic acid, resveratrol, exosomes, polynucleotides, as well as even the RRS products. And what usually happens is that, again, we get rejuvenation happening, healing happening, anti-inflammatory effects, and also, more importantly, a decrease in melanocyte activity when we're targeting things like melasma. Now moving on to the RRS, you can see these are injectables. These have been actually around for quite a while, and they are classed as a class 3 medical device, and you can see there's quite a large amount. So there's a wide variety, and this is quite important because if we presented all these techniques in our seminars all together in one go, it's just a bit too much to take in, and we have specific combination treatments to actually carry out and optimize our results. So there's at least around 15 to 20 RRS different injectable products, and they have specific formulations, which we'll talk about, that are targeting specific skin concerns, medical concerns, which are really important for us when we're carrying out our workshops to help with training. Now, a lot of you ask me about the safety. All of these RRS products are CE marked. What does that mean? They've gone through rigorous amounts of evidence-based testing, their research papers, as well as defects in terms of any on the skin itself. So there's no sort of safety issues with regard to using these products. Now, the main basis of RRS treatments is that they either have hyaluronic acid in their base, in their vial or the syringe that you're treating with, or they have some silicone base, which is an organic compound that basically acts like a glue, especially when we're treating very flaccid, very thin skin, and they contain a specific protective buffer in different combinations, again, depending on what it is we're wanting to treat with our skin concern. Now, we know that hyaluronic acid has a number of positive effects on the skin in terms of rejuvenation. It stimulates the fibroblasts, maintains optimal cellular skin conditions, activates the CD44, which is very important in collagen synthesis, improves collagen quality, and we'll talk about that a little bit later, as well as having antioxidants defending against free radical attack. Now, this was what I was mentioning earlier. You have your base of hyaluronic acid with or without silicone, and then you have your protective buffer containing different molecules. So, for example, different vitamins, caffeine, trace elements. We're talking about flavonoids, and also antioxidants such as resveratrol. Now, resveratrol is a very important antioxidant, and this is something which is very important in terms of skin rejuvenation, skin healing as well, and it's also anti-cancerous at the same time. Now, you can see in the top corners, left and right, there are a number of different skin concerns we can treat, and depending on which skin concern that we are wanting to treat, we can use a different particular products. For example, RRS HAIs, we have RRS HA Tensor Lift, we have Silisorg as well, and all of these can be used in combination. For example, in the Spanish Glow or in our training for Spanish Lift. So these are sort of different combinations we can specifically use. And we can see here that we have different types of hyaluronic acid and antioxidants. We have on the left the HyLift group, ranging from HyLift 35 going on to 75 and then 75 Pro. And as these are getting better and better in terms of technology, 75 Pro is one of the most advanced in terms of the HyLift group. And then we have the RRS products themselves. In terms of RRS HA whitening, tensor lift, skin relax, whitening. So all of these can be used in different ways to improve the skin depending on the skin concern. And then we have the silicone-based products where we have RRS Silisorg, Silisorg HA, and Silisorg Tensor. Now, depending on where you are in different parts of the world, you can have vials, you can have ampoules, and you can have syringes. And depending on where you are, they all are completely the same products, but just for logistic reasons, you can have them in different combination of storage vials, as it were. This is a very important slide showing you the different types of products that we have in the RRS range and how we can target different skin concerns. So we have Tensor Lift, for example, treating skin flaccidity. We have skin relax, again, which is very similar to botulinum toxin, and we can relax these products as well. We have also anti-cellulite treatments, for example, RRS+HA Cellutrix, and each of our training, when it comes to our seminars and face-to-face training, you can have different treatments. So you've got a wide range of indications. Any phototype, so all the way from Fitzpatrick 1 to Fitzpatrick 6 can be treated. Male or female patients, again, have no issues. There's no age limitation as well. There's no storage issues, and all treatments can be carried out in different seasons. In terms of precautions and recommendations, again, like we would carry out in any of our injectables, make sure that we have a consent form being signed. We go through all the medical history, make sure there's no contraindications, some people do say that, they have chronic conditions. So we need to explore the chronic conditions thoroughly to make sure that again, the chronic condition is stable. There's no recent change in terms of medication. Also check for any allergies to products. And a big no-no is pregnancy and breastfeeding. And again, in terms of after treatments, like we would advise in all of our cosmeceutical aesthetic treatments, avoid extreme temperatures, avoid saunas directly after the treatments, and also from the next day, makeup can be used. And I've just mentioned about this relative contraindications. And again, in terms of age, no problem with using anyone over the age of 18. Anything below 18, we wouldn't normally carry out with regard to these treatments. And in terms of recommendations, you can see over here in terms of the Glow-Go scale, you can use RRS products from mild to moderate to even advanced photoaging and also severe. There's no contraindication or no sort of limitation with regard to these treatments. And just as I mentioned, all the different Fitzpatricks can also be treated too. And in terms of improvement of wrinkles, again, you can see the RRS products are a fantastic recommendation for all different types, going from superficial wrinkles all the way to very deep wrinkles as well. So you have here extremely easy to use, very affordable in price, unique formulations to treat each and every aspect of skin concerns. And again, these are medical devices as well, where we're using mesotherapy techniques for biorevitalization. And this is just the final conclusion of the RRS products in terms of CE marking, safety, quality production. So they have the ISO certificates. They're originally formulated, very well priced even for yourselves and therefore the end user too. And also we can treat all different types of skin conditions. Now you will have in your own clinics, for example, where you're carrying out treatments for botulinum toxins every 3 to 9 months. You have skin resurfacing techniques, and we will talk about this in terms of chemical peels very shortly. You also may be using fillers in your clinic. And on top of that, you have the RRS products, which you can use much more commonly every couple of weeks to 4 weeks, where you're seeing your clients and maximizing their results. In terms of the advantages, again, one vial or one syringe is single use. One box is, for example, one course of treatments for each patient. So you know exactly how much to use. Again, you're not needing any special devices to carry out these treatments, just a syringe or an applicator. No need for special storage conditions. And you can combine the protocols, as I say, for example, to create a Spanish lift and Spanish glow as well. Now, what we always want with our patients are wanting results yesterday. And more that demand is growing. So we want fast results. We want good, effective, and safe results as well. But also, I'm not necessarily keen on the word, but we want them cost effective as well. Trying to combine all three together is just not possible, but we try and combine them in different ways where we can get the best results for our patients, against trying to make it as cost effective as possible too. Also, in terms of our injection techniques, the theory, what we go through in our seminars, there is also a special sub-website called Medinet for all our sort of trained staff and trained injectors who come to us for training. We can actually give them access where we go through the protocols and best practice guidelines through our Medinet site, and Galina and her team can give you that access. Again, not just injectables. RRS also provide daily care in terms of creams, and also in terms of daily skin care, in terms of the different types of creams and different types of treatments we're going to talk about, and also specific skin concerns. Here are some results where, for example, we have RRS HA whitening before and after treatment, as well as High Lift 75 Pro. And you can see how there is improvement in the skin, the whitening effect, the decrease in melanocyte activity, and how we can improve melasma with RRS HA whitening. We can improve again the level of skin glow, as it were, the radiance in RRS HA eyes, as well as the High Lift 75, and we can improve in terms of the skin texture, turgor, as well as the anti-inflammatory effect of these treatments. Here is a hero product, and you can see here that this is called RRS HA Long Lasting, and it's a filler alternative where we have 7 injection points, and we are injecting 0.2 mils per injection point. It's a 3 mil syringe, and we have a special protocol, and we have a special training program in how to use this product as well. It is a cross-linked hyaluronic acid, and it also has a very unique set of 15 different amino acids within the cluster, causing a positive effect in terms of immediate results and ongoing results, for which we've produced scientific papers for. And you can see here in the 3 mil syringe is 21 milligrams of hyaluronic acid. So it's a very fine hyaluronic acid, but at the same time, it's also BDDE cross-linked, and that just means it is extra stable within the skin and lasts that much longer as well. And you can see here, going from right-hand side all the way to the left, how we can class it as a skin builder. You can see how the dermis in the collagen is much more regulated, much more dense and coming together. And that's one of the big reasons why we class it as a skin builder. It is not classed as a filler because it's too thin to be a skin filler, but it's also not classed as a biorevitalization agent alone, because it has some filler component within it. So therefore, it fits very well in between a skin booster and a filler, where we call it a skin builder. And you can see here some nice results within 1 week of having one treatment, especially under the eyes. You can see the texture of the skin also improving, and also the mid-face volume at the same time, and a very significant improvement underneath the eyes. Men are having this treatment just as much as women, and the demand is growing. And again, you can see under the eyes, quite significant improvement within 1 week, and skin turgor and that fresh look, that radiant look as well. Now, why should we leave it at just injectables? We also have chemical peels. So Skin Tech traditionally is very well known for its chemical peeling and the technology behind it. It has alpha hydroxy acids within the peels. It has salicylic acids, trichloroacetic acid, or TCA, which a lot of you may have heard of, and also phenol. And there are combinations within these chemical peels where we have kojic acid, phytic acid, retinoic, ascorbic, and thioacetic acid as well. And you can see here from this slide where we have a number of different peels going at different degrees or different depths within the skin, depending on what sort of skin problems you have, going all the way from the easy phytic peels all the way down to the lip and eyelid, where we are containing the phenols as well. Now, we have specific training programs where one of my colleagues, a specialist in chemical peels, carries out the training for the healthcare practitioners. And you would need to be, as you go much deeper, and I'm sure you'll understand that you will need to be much more medically trained and much more experienced in aesthetic medicine to go down to the phenol route, where we are initially starting at the stratum corneum and the epidermis and going all the way down into the dermis, even the reticular dermis, where certain medications also need to be applied when carrying out these peels. Now, a lot of, when it comes to the scientific evidence, there is quite a large number of literature reviews in terms of the mechanism of action of the chemical peels themselves, but also how the ingredients together can treat different skin concerns. For example, active acne, dyskeratoses, melasma, as well as photoaging and its consequences. Here you can see some very nice results, befores and afters, where we are combining easy TCA, for example, the trichloroacetic acid, along with the blending and bleaching cream and the DHEA, which is available for Med and Skin, and also easy TCA on its own. And you can see how we have significantly improved the melasma and the pigmentation just within one treatment. And again, easy TCA with just a blending and bleaching cream, we can improve pigmentation, we can improve skin quality, pore size as well. And this is Uni Deep on the right and Only Touch with easy TCA, where we have targeted specific sunspots, as it were, to improve the skin condition too. Lip and eyelid, much more significant peel, much more medical oriented peel as a medical procedure itself. And again, on the top right and the bottom, you can see the easy phytic with, again, the creams that can be provided as well as the easy phytic purifying cream alongside. So there's quite a vast number of skin concerns that we can treat and use. And I'd like to thank you all for watching this brief introduction where we have covered the cosmetic trends, where we are heading in 2025, and also in terms of skin peels, the RRS product range as well, and also in terms of the peels. And anything else that you would like to ask me in terms of questions?
I have a question. Actually, I want to ask you, who can use our products? What kind of available?
So quite enough. Well, I would say in terms of basic treatments, when we are using the RRS products themselves, you don't need to have GMC registration or nurse registration, but you can be an experienced aesthetic practitioner to use the RRS products. But when we are going and heading to phenol peels, easy TCA peels, then yes, you need to be medically trained and medically registered. So that's a very important question. So we get a lot of experienced aesthetic practitioners attending our RRS courses, and they find it very nice as an addition to the treatments that they produce and the results that they produce in clinic too.
Okay, thank you. Do you have another question, Celine? Maybe you can ask doctor whatever you want.
Who are you asking? Sorry.
Celine. Okay. I think I just want to announce we have a special offer, only 3 days, for the RRS long lasting, just £60, including VAT. And for all injections, 20% discount and skin tech pills as well. So if you are interested in this offer, just message to me directly at their order, and we will send to you the products.
Yeah, I would love to try some, Galina, actually. I'm just completing registration.
Great. And what sort of treatments are you using, Celine?
So at the moment, I'm using Revoc 50, which I use as a skin booster for my clients. But I have used the RRS and I really, really liked the results with that one. So I have I'm just in the middle of recently registering for obviously to Skin Tech to use the RRS products. I use Environ skincare as well. I use their TCA chemical peels and I use Dermavigils.
And without putting you on the spot, Celine, I mean, now that you are one of our viewers and us, and just interacting with us, what sort of results have you noticed with the RRS HAIs so far?
Yeah, I mean, obviously, I used them just before Christmas on a client. Her eyes were much more dehydrated, and the darkness under the eyes I noticed, and it was quite visible quite quickly as well. So
your patient was very happy, or?
yeah, no, she was very happy, and she noticed a difference. She would have them again. So I want to become more familiar and actually do the training because I believe Galina is going to set that up in March.
Yes.
Yes. So I'll look forward to learning more about the products and introducing them into the business.
Great. And just as you mentioned, you know, the RRS HAIs, you've had good results. We have specific training for RRS HAIs, but also combination treatments where we can, for example, introduce that what we call the Spanish glow,
Yeah.
which is a big trend within the aesthetics industry, where we combine different RRS specific treatments together to really boost that radiance within the skin. Which also includes one of the hardest areas to treat, which is the infraorbital, just underneath the eyes and around the eyes, the periorbital region. Is one of the toughest and most demanding areas for aesthetic practitioners. So already you're getting very good results with RRS HAIs, and that's a tribute to the product themselves, but also in yourself as a practitioner who has learned the techniques and the correct techniques, but also the safe techniques to carry out the maximum and optimized treatments for your patients.
So, Dr. Javed, if you don't mind me asking, when I was administering the eye treatment, I used the microjet needle, but it's not, I don't think it's the best one. Could you recommend, I felt like the fluid was sort of leaking a little bit. So I need to change. Is there any particular one you would recommend for using for that area? Because it's quite a sensitive area, of course.
It is a sensitive area, and believe it or not, I use a normal insulin syringe when I actually treat with RRS HAIs. But I have used a micron jet. It can be good, but it may be just the technique. I mean, how long have you been using the micron jet for?
Yeah, only recently, so I'm still coming to grips with microjets.
Like insert, dip, and flip technique that you may have been shown, but it is a very unique technique in terms of inserting and the amount of pressure. So one of the things that aesthetic practitioners sometimes are not doing, at least initially when using the micron jet, is actually it's the gentle pressure. We try and give, because we normally used to using syringes, we use a much stronger pressure in trying to get the micron jet in, and we sort of need to sort of use a much smaller amount of pressure and then just gently dip and flip that needle, and then you will find that the fluid doesn't leak out.
Right. Is that, yeah, you wouldn't recommend any, I mean, you said you used a different syringe, the insulin syringe.
Yes, I use an insulin syringe. So I just create a microdermal papule with the RRS HAIs. And again, this is a technique I teach in my seminars when you attend, so that I make sure that you know exactly how to create the microdermal papule. And then just the microdermal papule diffuses within the skin gently within 24 hours.
Yeah, yeah. No, I have used Neofound in the past.
Yeah. Another one is the NanoJet. You may have heard of this. That's another, again, very similar to the Micron Jet itself. But these are, other brands that are out there which do similar things. Now, as I say, with the RRS talk that I've just done with yourselves, one of the things that we do pride ourselves in is you don't necessarily need to have a specific device as such, which is why I show from basics, meaning the insulin syringe and how to make sure you create the microdermal papule. And being honest with you, some of the aesthetic practitioners that I teach, because they use mesotherapy techniques in their day-to-day practice quite often, some of them are even better than me and faster than me when carrying out the RRS HAIs. Now, the other thing is just as an extension to what we've just mentioned with the RRS HAIs, you can treat skin flaccidity, the puffiness underneath the eyes, by going quite deep into the skin and onto the periosteum. And again, in our training program, when practitioners attend, we show how with just 3 injections underneath the eye, you can treat skin flaccidity as well as puffiness as well, using the same product that you've talked about, RRS HAIs.
Right. Okay. Thank you, Dr. Javed. Thank you.
Very welcome, and thank you for participating.
You're welcome.
I want to announce that on 12th of February at 11 o'clock, we will have a special webinar, Spanish lift and cellular tricks for the face. You're very welcome. Celine, you can come.
Yes, I would love to come. I'll pop that in my diary. Thank you, Galina.
Yes, it's a very interesting, a very unique training where we are combining specific products to boost the results, because as we know in the aesthetics industry, when you're using just one particular treatment, fine, you'll get very good results. But when you're combining 2, potentially even 3 treatments in one setting very safely, you can, even double, triple, quadruple the extent of your results all at the same time in one sitting. And with clients and our patients being extremely busy individuals, you find that doing a lot of things, but safely at the same time, using best practice protocols, you can actually maximize their results all at the same time.
And Dr. Javed, will you be doing the training in Scotland in March then yourself? I forgot that.
I think I have been told that, yes, that is the plan. I think it's in Glasgow. Am I right, Galina?
Yes, you're right. Actually, we will try to organize. I am working on this. So, but before the seminar, we just discussed with Dr. Javed to organize the webinar. It's a good reason to just to learn something more about this protocol, to see how it works. And after that, I will try to organize the practice in Glasgow.
We don't have a date as yet, Galina, so as soon as we get a date, you can
actually, we have a date. I told you, just a moment, I will check.
While you're looking for that, Galina, Celine, where are you based? I
Glasgow. On 21st of March.
The 1st of March.
21st of March, we have a plan to organize the Spanish lift seminar in Glasgow.
And will you be just doing the Spanish lift, or will we be looking at some of the RRS, the other products as well?
Yes, so the whole point of Spanish lift is actually combining different RRS products all in the same sitting and targeting specific areas of the face, and optimizing the results. And the lift itself that was generated is what we class as the Spanish lift.
Right, okay.
Okay. Thank you, Dr. Javed, for this webinar. Maybe somebody want to ask the questions? Oh, it's all fine. Okay. So I think we can just finish our webinar. Thank you for your time. Thank you for that you're sharing your,
You're very welcome, and thank you for everyone for sharing their time during this afternoon to come in on our introductory webinar, and we look forward to seeing from you and also hearing from you soon. So thank you so much for your time today.
Thank you.